updates, weekly updates.
I met TJ earlier.
Yes, we've got TJ, we've got William, the super cat. There's
TJ.
There's TJ. Did you know TJ actually has diabetes?
He does not.
Yeah, we're going to talk about diabetes in your pets. Dr. Julie Schell is going to wade into that tough topic, how to treat our pets and keep them healthy and happy. Thank you, Daniel. Dr. Julie Schell is back with us this morning to talk about how to recognize, monitor, and then manage diabetes in our pets. Thanks for being here this morning.
Thank you, Susanna.
We also have Jennifer, who's brought in William, the fabulous cat. William is diabetic, recently diagnosed. And then Brittany has brought in TJ, the beautiful little dog. And TJ dodged one and was showing signs of being diabetic down the road and has lost some weight. So thanks for bringing your pets in this morning. Julie, I want to start with signs that your pet is either about to be diabetic, like TJ here, or already are diabetic. What are we looking for?
Some of the most common signs are weight changes. Animals are all of a sudden losing weight when they're diabetic, and also they are drinking a lot more water and urinating a lot more. The litter box looks a lot wetter than it used to, or the dog has to ask a lot of times during the day to go outside to urinate.
Okay, now Jennifer, what were the signs that you knew something was up with William?
Oh, he lost almost half his body weight, I think.
Wow.
So he got very skinny.
And what was his appetite like?
Not bad. I didn't really notice a change. I just noticed the weight loss because it was very quick.
And Julie, you said sometimes with diabetic pets, their appetite is elevated because their body's not being satisfied?
Yes, that's right. It cannot take the insulin in their blood system and use it in the cells because there's no insulin to do that. And so they are always in a state of starvation, even though they have a voracious appetite. Their body cannot handle the food that's coming in. It just gets urinated out.
Oh, wow. Okay, now Brittany, TJ, you were told when TJ went in for a checkup that you needed to make some changes and he needed to lose some weight. Was that tough to get him on that program?
It was at first. He didn't really like the diet food too much, but then we started mixing in the wet food and we found out that he loved it. I think the hardest part for him, like any regular diet, was cutting out the junk food, so like the treats and stuff like that. He'd go to the drawer and he'd want a treat, but we couldn't give him one because it was just out of his diet. We couldn't give it to him.
Now he's lost weight, he's looking great, and he's healthier?
He is healthier and he has a lot more energy too. He's getting showered with treats right now, so he'll behave, but no, he's lost a lot of weight. He's got a figure now, which he didn't before. He looked like one big round ball.
He's doing great. Now, Julie, are there specific breeds of dogs especially that you have to watch out for with this kind of thing?
Yes, I have seen diabetes in all dogs, small and large alike, but it seems to happen more often in smaller breeds. And so I'm not sure if that's because they perhaps are a bit more prone to obesity, or there could be a genetic involvement. There's still no real understanding as to why certain animals are predisposed to diabetes compared to others, but definitely weight problems and genetics definitely can play a role.
Okay, let's jump forward. Your pet has been diagnosed, like Jennifer, with diabetes, and so you've got to make the decision that you're going to treat and commit to it, and it's a big commitment. This is what do you have here?
This is a blood sugar reader, and so often when I have a cat or a dog that becomes diabetic, I ask the owners to help by doing a blood sugar curve at home, because then the pet is in a nice low stress environment. And so what they can actually do is be trained. We can train them on how to collect blood from their pet and use it on this machine to measure a reading. And it's very easy to do after a while.
It involves a needle, though, and
It
a lot of
does.
people are anxious about that.
Yes.
You find you're able to train people how to do it? And
Absolutely. We get them to practice actually on fruits and vegetables first. When they're using a needle, they will inject some liquid into a fruit or a vegetable, or they will practice on sponges, and that makes them have a higher level of confidence until they're ready to move on to their pet.
Jennifer, did you find this daunting?
No.
No?
No, I'm not afraid of needles.
Good for you.
It was easy.
On top of the fact that you got to do needles, this is a big financial commitment too. Was that a big stressor for you?
No. My pets are my babies, so I do whatever I have to do.
Understandably.
And pet insurance helps too. A lot of times the pets will be having insurance, so it is covered.
Okay, now outside of the insulin, there are other ways you can treat and work with this and also bring down some costs. What are some of your recommendations?
Yes, often there are some alternative methods. There is acupuncture and herbal medicine that can be done, and it takes a lot longer to get the animal regulated, and you have to be very cautious and slow with the procedures, but that can help. And some animals we've actually been able to wean down their insulin dosages and by changing their food and adding on herbs and doing acupuncture. Also finding the underlying illnesses that they have and treating them. Things like dental disease will also help decrease the cost of diabetic management in the long term, because the insulin requirements will be much less if the animal doesn't have any inflammatory diseases like dental disease or Cushing's disease or other types of illnesses on board as well.
So in William's case, so when you talk about special diet, what kind of changes would you recommend?
For cats right now, they are recommending a high fat and high protein diet, and that's a very interesting thing because it's almost like the Atkins diet for cats that we recommend. And the research shows that if you can feed a cat a high fat, high protein diet, it helps regulate their blood sugar levels a lot better. It also helps them lose weight because they are feeling fuller for longer periods of time with the nice high levels of protein. So if the kitty's kidneys can handle it and they're healthy in every other way, then putting them on like a prescription food that is high fat and high protein really does help.
Well, we love our pets, and we'll do anything to keep them happy and healthy. Thank you for bringing in TJ and for William. There's a great resource out there, bowbottomvet.com, for more information on diets, treatments for a pet that might be diabetic. Dr. Julie Schell, thank you once again.
Thank you, Suzanne. My pleasure.
We're going to take a break here on BT. We've got an update on that traffic snarl on Deerfoot and Memorial right after this.